What's important about this report is that this is Manitobans speaking to primary care reform and the changes that they want to see in a healthy primary care system.
With healthcare top of mind for many as we go through the cold and flu season, University of Manitoba faculty members are sharing recommendations on how to improve the primary healthcare system here in the province. The report found that Manitoba has the lowest per capita number of family physicians in Canada. Dr. Alan Cates, who is a co-lead in the report and a family physician, says the report highlights how Manitobans are feeling about primary care, and he says they aren't feeling good about it.
Over the years, we haven't really been planning adequately for the human resources in healthcare. The population has grown. Manitoba in particular has grown a lot, and we haven't had the ability to grow our workforce in keeping with the needs of the population.
The report highlights 37 recommendations, 9 of which were created by Indigenous members for Indigenous people. Some of the key findings include a shift to team-based models in healthcare delivery, extending primary care after hours and providing 24/7 access, and protecting patient health information in a centralized electronic database. Co-lead Dr. Amanda Condon says 30 Manitobans were selected to give feedback for the report and hopes that these voices can bring the recommendations to fruition.
Because it comes from the patient voice, it's an extra added layer of work that can be used by policymakers and decision makers to give some guidance as we're looking to redevelop the primary care system in Manitoba.
Manitobans living in rural and northern communities face greater challenges. Some other recommendations include setting up mobile health clinics for rural and remote residents and creating an Indigenous health department in the provincial government. Thomas Linner from the Manitoba Health Coalition says there needs to be a focus on helping the most vulnerable.
That's where we need to start. These are the folks who end up in our emergency rooms if they are not able to access the kind of services, primary care services that they need. So that's something that we need to focus on.
In Winnipeg, Alex Karpa, City News.